take your garden. All you want is to feel better, but you're beginning to wonder if you'll ever be your old self again. You're not alone. Back and neck pain are common complaints. When you think of all the work that your back and neck do each day, constantly moving, bending and twisting as you go about your day-to-day activities, it's not surprising that problems develop. A misstep or a wrong move, and the mechanical actions of your spine can get out of sync, causing injury and pain. A muscle may pull, a ligament tear, a bone fracture, or a nerve become pinched. It's estimated that more than 80% of American adults will experience at least one bout of back pain during their lifetimes. Back injury is the most common cause of job-related disability and a leading contributor to missed days of work. A survey of U.S. workers found that about 1 in 4 has experienced low back pain at some point in his or her life. Back pain has few boundaries. Men and women of all backgrounds are affected. The older you are, the more likely your chance of encountering a bout of back pain. Prevalence of low back pain increases with age, with the highest incidence occurring in individuals in their 50s and 60s. But back injury isn't limited to middle-aged and older individuals. In recent years, doctors have begun to see more teens and young adults with low back pain. Speculation has it that this may be partly due to more young people hunching over laptop computers, tablets, and other electronic devices. Neck pain, while less frequent, also is a common complaint. Studies suggest that somewhere between 10% and 30% of the adult population is bothered by neck pain. Similar to back pain, it peaks in middle age. However, unlike back pain, neck pain tends to be more common in women than in men. Most often, an episode of back or neck pain is a short-term event that resolves over a period of days or weeks. You stretch or twist something and feel the pain for a period of time, and then it gradually gets better. But not everyone is that fortunate. For some people, the pain continues beyond the normal period of healing, lasting months or even years. In other individuals, the pain improves for a period of time, but recurs. And each time it recurs, the longer it seems to last. Many causes. Back and neck pain can develop for a variety of reasons. Typically, the pain is associated with some type of mechanical damage, a pull or a tear, a slip or a crack, a pinch or a bulge. It may be something seemingly trivial that triggered the event, such as bending over, sneezing, or coughing. Or it may be something more serious, such as an accident or a traumatic injury. Because back and neck pain are so common, you may think they're inevitable. However, certain factors and occupations put you at greater risk. Your odds of experiencing back pain are increased if you smoke, are overweight, are inactive, or are experiencing stress, anxiety, or depression. A physically demanding job, especially one involving heavy lifting, unbalanced stretching or bending, or subtle, repeated actions, can increase your risk. So can a sedentary job, sitting at a desk or in front of a computer all day. A sudden change in activity also can be a problem. For instance, not getting any exercise during the week and then diving into a strenuous weekend workout. Finally, and not surprisingly, age and years of wear and tear on your bones, muscles, and ligaments put you at increased risk. Back and neck pain associated with wear and tear, degeneration, often tends to develop more gradually. And it may be that pain isn't your only concern. It's not uncommon for back and neck pain to be accompanied by other symptoms, such as weakness, numbness, and difficulty with certain movements. And the pain may spread. Back pain may extend down one or both legs. Neck pain can migrate to your shoulders and arms. Your back or neck may be the culprit, but much of your body may be feeling it. A weighty toll. When your pain first developed, you may not have thought too much about it. You figured in a day or two it would be gone. But as the problem persisted and it started to limit your daily activities, you began to get worried. What does the pain mean? How long will it last? Should I see a doctor? Should I go to work? Can I afford to miss work? Back and neck pain can take a big toll on your life. Fear and worry, along with difficulty sleeping, can leave you feeling irritable. In addition, you may feel guilty about not being able to participate in events or activities or having to hand off some of your daily